it may take 6 months or up to a year and a half for people to start seeing improvements in their cognition. But if they get off the program, it could be 2 weeks before they start relapsing. Weeks,
Yeah.
which
Yeah.
is no way that's fair. If it took you 18
Yeah.
months to get better, why is it that it only takes you 2 weeks to get worse?
I am sitting down with Dr. Myrto Ashe to talk about her new book, The Simple Science of Wellness: 60 Unusually Effective and Accessible Practices to Restore Your Health and Vitality. In this episode, we're talking about her book, but also the powerful work she's been doing to help people with chronic illness actually start to feel better, not just manage numbers or manage symptoms, but to truly find healing. We are diving into why so many people feel dismissed or stuck in the conventional medical system, and how we can utilize a deeper and more root cause approach to finally start to shift things. She shares her years of personal and professional insight and experience to help us understand what really makes a difference when it comes to symptoms like fatigue, brain fog, autoimmune issues, and so many of the vague and debilitating symptoms that women can experience. This is going to be a really valuable conversation, so I hope you enjoy it. You will notice that this episode was recorded when I was recovering from a terrible case of laryngitis. So thank you in advance for your patience with my voice as I try to get through this episode with enough voice, and I hope you'll still find the information helpful. We'd love to hear from you if you like it, or if you have ideas for future episodes. Feel free to reach out anytime. Here we go.
We have more tools so we can fix some things that you would normally use medications for. And also then we're going to ask you to do the difficult thing that's going to get at the underlying cause, and that hopefully you will not need our little party trick either at some point. And that's kind of that's where the hard and the easy come in.
Well, Myrto, thank you so much for coming on. You have been a mentor to me, and I've learned so much from you. So I'm so excited that others get to learn from you today.
Well, thank you so much for having me. I'm looking forward to this.
Thank you. Well, we are going to talk today primarily about healing from chronic illness. This is something that you are instrumental in helping so many patients to do, and I know you'll have tons of insight. Will you tell us first a little bit about your journey from being a conventional family doctor to having this experience of transitioning into integrative and functional medicine?
Sure, yeah. I think that actually it's not an uncommon story. I actually graduated from McGill University in medical school, and went to do my residency in the States to do family medicine residency. And I really loved the idea of family medicine, and I was a family doctor for 20 years in community health centers. And I really felt like that was my thing. I loved doing that. And at some point, my kids were a certain age, and my husband was just starting his practice, and it was too much. And so I decided to quit. I'd had less than 20 years by that time. But anyway, but then, I mean, part of the reason why I was quitting is because my kids were presenting with some issues, and someone had to focus on that. And it was too much to try and do everything. And so I had time and started doing what everybody does. I'm Googling around to see what else there is to treat these conditions that I was, so I guess ADHD is the condition that we were dealing with, and the way that it was presenting. And so we moved. I knew Mark Hyman from before, who has been, a big figure in functional medicine. And I was at the library one day, and I picked up a book. I wonder what Mark he's up to, like literally, like, I don't know what he's doing with his functional medicine anyways. Some probably made up thing that Mark has come up with. And I just stumbled across this table that showed where he said that ADHD was caused by neuroinflammation. And it was a little irritating because I'd never heard of neuroinflammation. And I consider myself a person who does a lot of reading, and I was reading Journal American Medical Association every week. And how is it that I didn't even know the word? But we have the internet. We have our computers are linked to the Library of Congress, and so I was able to study this, and was really excited to try Mark's interventions, given that he had come up with a diagnosis that I thought was correct. So I put myself on his elimination diet, and that's when the little miracles happened. I used to have joint pain. I used to have asthma. I used to, have an extra 15 pounds from my 3 pregnancies, and all of that evaporated without any effort on my part other than really following the diet and taking some vitamins. I even found myself with more energy than before. It was kind of obvious because at the end of the day, the kids were like the ages between 5 and 10. And the end of the day, I would be able to finish the dishes and clean the kitchen, where before I had been putting it off to the next day. So it was really like an obvious transformation. And I thought, well, it would be fun to do this. If I had to go back to being a doctor, this is what I would want to do. But could I? Right? We always like, it
Mhm.
seems like you have to be so smart to do this. Like, could I really learn how to do this? Like, it would be pretty cool. So I did. I tried, and it worked out. So I'm really happy that I did. I opened a practice that was kind of modeled a little bit on a psychiatry office, so like much simpler than a medical office, like just one person. And eventually, I got part-time assistant, and that's pretty much what it still is. I never had the sort of the ambition to run a multiple provider place.
Well, I love that story. I love the simplicity of it. I think oftentimes, and I think this is getting worse and worse, the longer functional medicine exists, the more we complicate it. And it's really the perfect intro into what we're talking about today and your approach, because one of the things I respect most about you is how, number one, you mentioned you used to work for the community clinics, and it's so obvious. You are so compassionate towards people and helping people, start where they're starting and be able to make these changes with what they have instead of being the fanciest, shiniest, most expensive model out there. You've really focused, I think, on doing the doable. So I appreciate that about you. And along those lines, then, one of the things that you're also very good at is really staying with the data and not doing things willy-nilly just because you heard it from some other functional medicine doctor. You've really focused on scouring the data and staying up on the data. And if you're going to do something, making sure that there's either data behind it or that patients understand that we're veering from that for a good reason and that there's theory and wisdom behind it and letting them decide. And I think you've combined these years of experience into this excellent book. Will you tell us a little bit more about your book, The Simple Science of Wellness, and what went into writing that book? And then we want to, of course, dig into your approach and what you share.
Yeah, sure. So thanks for that. And I think what I learned from community health centers, also from growing up in Canada and going to medical school, really where medical care is free at the point of receiving services, was that you can do so much good with that, and that's a starting point. And like, I was able to help people who didn't have insurance. With we have limited tools. I don't work in that setting anymore. And then where it went to is sort of this idea of ancestral wellness. The book was going to be called Ancestral Wellness at the beginning, which is sort of my observation that in the end, the things that are most helpful and that we can rely on, the reason why they are as good as they are is because they go along with a way that the body was already structured. So it's obvious. Depression is not caused by Prozac deficiency. Therefore, when you're introducing something that wasn't the root cause, then you have a chance of causing problems. And even the ones that we have accepted over years, let's say aspirin, for example, right? We had this idea that aspirin was preventing heart attacks, and sure it was, but it took like a couple of decades to figure out that yes, but it was also killing some people, and the trade-off actually wasn't worth it. And so this is 40 years into this right now. I mean, this is really the theme of conventional medicine. We have helped people in so many ways, and we have not known of some of the harms at the same time. So, having gone from that system to deciding I'm going to adopt something brand new that involved completely different tools, I was really feeling a little peeved. Like, I have worked really hard on the 4 years of medical school, the 3 years of residency, and the umpteen years after that of practice. And I absolutely do not want to get bamboozled or biased into a type of number of practices that are actually also ineffective or have side effects and so on. And what can I do then? Can I use each practice and start thinking a little bit about it? First of all, Does it get at root causes? Why might it get at root causes? So, and also, I guess at the same time, maybe it's me being practical. Sometimes, we joke as functional medicine doctors that we're not sure we can afford our own care. You know what I mean? And it's funny, not funny.
Mm-hmm.
So anyway, maybe it's the practical side of me who was like, okay, so wait, this is a free tool. Does it have validity? Does it have ancestral relevance? Does it have, in that case, why wouldn't we prioritize that one then? So what if I don't necessarily make money from it personally? Like maybe that's not doesn't factor as much in my equation because I don't have a big center and I don't have people to support other than myself and my family.
Well, tell us a little bit. What I want to do in this episode is I want people to leave feeling very hopeful. There are definitely a lot of people who have struggled for so long. They've seen every doctor, they've gone through everything. Many of them have even seen multiple functional medicine doctors, and they've tried buckets of supplements and they've done all the things. So, first, if you'll tell us a little bit about the types of patients that you see, what are they coming in for? What are the types of symptoms and this constellation of things that you're seeing so often from patients? And then we'll move on to how you approach it.
Yeah, so early on, I realized that who would be coming as people who weren't happy with the conventional system because they're still looking for an MD. So they are not, they haven't given up on conventional medicine and this type of training and this type of knowledge. So it's all the people who really aren't happy with what their doctor said. Either they don't want to take the pills the doctor recommended, or the doctor said there's nothing wrong with you, or the doctor said there's nothing I can do to help you. And that's pretty much who I see. These days, the ones I feel the most excited about are people with GI issues because it feels like I have a good system for them. And also, I'm interested in the whole longevity aspect and trying, and this is my family medicine training sort of coming out to the fore, my public health training. What are some things that we can do to be healthy long term? And cognition has been really interesting because there's a fairly large number of patients that can improve their cognition. And it's a little magical trick because it feels like we're cheating. We're not supposed to be able to help them.
So,
We're
speaking
told
about
that
dementia and Alzheimer's.
cognition, yeah, cognitive decline is irreversible and nothing could be done. And plenty of research really that that's not true, but it's not. It's taking it a little while to seep in. So anyway, those are but I'm not always sure that I can help a person with cognitive decline. But with GI, it's almost always that we can get a whole lot better, even if we don't get 100% well. So that's exciting. So I think that, you need to be sort of, listen carefully and see if there's something maybe that has been missed. It might be different in different people. Maybe go through things again systematically and make sure and see if they want to. Sometimes iteratively they have to repeat some step that maybe helped a little bit, then they need to do more of that. So there it's more about listening. And in fact, I have an initial half hour strategy phone call. And part of that is because I want to make sure that I do have something to offer. Some people really have tried everything, and I'm going to be honest with them. Who wants to have, two sets of frustrated parties working on something that, if I don't have something for it?
Yeah, for sure. Well, tell us, when you sit down with a complex patient, how are you starting? What are the top things you want to know to help them understand kind of where to go next? Do you have an order of operations that you use when you're saying, with these functional medicine patients, what I see is they'll go to another practice and that practice will often order tons of testing, and then they'll say, there are 18 things wrong with you, so here's a different supplement for every one of those 18 things. And oftentimes people don't get that much better, or they get overwhelmed, or they're having side effects now from all of the supplements. What has been your approach when you say, like, yes, there are 18 things, but there are some that matter more than others?
Yeah, so for me, the ones that the tests that I'll prioritize over others are the ones where I have either some evidence that they work or a lot of experience and have seen them to work. And I tell people which is which. And so I do three things when I start. So first of all, listening to of course, taking the entire history often takes 90 minutes to figure out everything about someone. sometimes 45, depending on the age. Like a teenager might be 45 minutes, but 70-year-olds is going to be 90 minutes. And trying to see in that timeline that we develop in functional medicine, if I can figure out what are the triggers, what sets this person off when they've come down with a diagnosis or a problem, what preceded it, what is the sort of thing that triggers this person, and also what seems to have helped them over time, and what are they still stuck with, and so what are some sort of recurrent themes. And then I have a few things that I call party tricks. Like there are some things that I can improve easily, and I'll do that. It doesn't necessarily always work, but it's so fun when it does. People who have terrible sinus issues will get better with a sinus probiotic and a nasal probiotic, and that's like, it's so nice. Like you take one thing off the problem list, and you didn't cause any illness. You didn't cause any additional side effects. Oh yeah, there was a cost, but it's not a large cost. Or sort of put some things in place to think about the future. Like if we know there's recurrent UTIs, I have a UTI protocol, and it works. It works really well to maybe prevent 80% of the need for antibiotics. So think ahead, like, are we going to need to prevent yet another impact on your gut biome? So there are a few things like that I will do just to alleviate suffering, but they're sort of more, to me, I think they're more entertaining than deep medicine. And then I'll do three things at the same time. I'll test people's nutrients. And for each nutrient, I've gone through the literature to see if we have data that not only of what might be an optimal nutrient level, but also data that if you supplement, you can get a health outcome change, because that's not always the case, right? We know that people with higher vitamin D do better, but vitamin D doesn't fix all of the things that correlate with health anyway. So in medicine, it's always complicated like that. Just because the higher level is better doesn't mean that coercing the level higher will actually fix the problem. So I wanted to look for both of those. So I have my little list of nutrients that I check on everyone, and I'll tell you the most common deficient nutrient is omega-3 fatty acids by far and away. There are some people with omega index there's one person who had, I think it was 1%, a vegan teenager. She hadn't been near a fish, or also probably was eating low fat. I don't know, but it was, 1%. Just recently I had one at 2%, just a regular
And what
adult.
are you aiming for?
8 to 11% is what we know to be the optimal level, and that we know that adding omega-3s does have an impact. And the stuff that you read in the newspapers is somewhat biased or incomplete information. So I'll prioritize the things where I have studies. So that's one of the three things I do when I start. The second thing is glucose regulation. People, we need to see if people are pre-diabetic. They're having very large glucose spikes because those things are inflammatory. And then the third thing is doing something to optimize the gut bacteria, the gut biome. And that's like a bigger deal. I usually combine 3 or 4 things at once. This is one thing I learned to do in functional medicine that I think conventional medicine does differently. It's this idea that a lot of the things that you do have a 2 to 3% improvement. So you can't just do 1 or 2 or 3. You may have to do more than that. I don't think I had that kind of mindset before. And so I do those 3 all at the same time. And it works because people come in with a lot of energy and hope. And they in their minds, they were going to prioritize this. The initial visit is expensive, so they are already, in that mindset that this is going to be top of mind for them. And we get the biggest impact, which is, by doing all of these things at once. I expect an impact within 2 to 3 weeks, and that people will notice. And then that brings its own improvement. Hope is its own healing ingredient.
Yeah, it's everything. Yeah. Especially for a lot of these people who have lost hope, who say like, this is going to be the same as I've experienced anywhere else. But I'm so impressed by humans because most of them don't give up. They may be frustrated, but they keep coming and they keep trying and they keep looking for the next practitioner to help them.
Absolutely. That's something from from conventional medicine and from community health centers. Yeah. The sense that you're meeting these humans and that you admire them. And it's, this whole hierarchy thing that we have, the white coat and stuff. but we're admiring them, and I don't think they know this. Many of them, I tell them, I'm like, you guys, like, because they're like, they'll like, in the strategy phone call, they'll be like, well, my doctor said this, but I thought to myself, I don't know. I don't think that's all there is to it. Like, what do you think? And I'm like, yeah, it took me like 20 years and a lot of education to come to your conclusion. And it's really impressive to me how people have sometimes intuition that there's more to it. So anyway,
Yeah.
I'm impressed.
Yeah. No, people are really incredible, and getting the lens that we get to view as providers and healing support, it's pretty wonderful to see what people do for themselves. I want to talk about your book. Your book lays this out so nicely, and I want to just read some of the chapters because as I read through even just the chapters to start with, and I'm so bummed I left it at home. I wanted to show people who are watching the video on YouTube because so many functional medicine books or these books that we've seen out there that are like how to get better, what are some things you can do now to get started? They're like this thick, they'll be 2 inches thick, and you're like, gosh, that feels overwhelming. Like that's going to give me the whole history of functional medicine, and then it's going to tell me all the things that I'm doing wrong and all the things that are going to kill me that I'm already doing. And I really appreciate that your book is just directly to the point. These are the doable things you can start doing right now. So let me read a couple of the chapter headings. You talk about fasting methods. You talk about free and low cost interventions. You talk about no cost practices that require some learning, premium interventions that are worth the investment. These are so important to differentiate because I think often when people seek out healing, the only ones that they get are the premium investments. And a lot of practitioners will say, this is worth it. Do you want to get better or do you not want to get better? Then do the really expensive thing. So I love that you differentiate it. Talking about tracking your progress, maintaining motivation. What will you expand on kind of how you have utilized these things in your practice? And then we'll get into some of the, gold nuggets here, some of these things that people can really start applying on their own today.
Sure. Yeah. So as I started to write the book, I started making these lists. I had as I was working on other things, I would list these interventions that I had learned, as tools that I was using in functional medicine. And I noticed that they could, a lot of them were absolutely free. In fact, fasting is, money saving, not only free, negative cost intervention. And if you have something that costs nothing or even saves you money, and that is fairly easy to learn, for example, shifting your eating window, for example, early in the day, let's say, because we have some data around what that does to glucose regulation. We have research showing the impact of it. Wouldn't one want to absolutely start there? And we have some ancestral thoughts around it that humans are, in fact, prey animal to a point, and that maybe running around in the dark trying to catch something to eat is likely not the way we evolved. And so it actually probably makes sense to eat when it's light out and to eat early in the day and so on. Yeah, so as I was writing them down, this is why they ended up in these different chapters. And then I realized that some were actually difficult to learn and that I would want to warn people as they go through the chapters and maybe start with the really easy ones, hopefully get some impact from them, like get out in the morning and expose yourself to sunlight. Anyone can do this. You hopefully have at least a balcony or a window you can open, or a little walk you can go on. And there's good data, a reason to believe that doing this improves the ability to fall asleep at night, which is something that so many people struggle with, and that there are so many supplements and medications and so many drawbacks of the medications that we have available, right? So this is something that's a very serious problem. If you can even improve yours by getting out and in the morning in the light, which is free and easy for anyone to do, then that should be your bedrock. That really ought to be your bedrock. I think that it's clear that in a regular clinic, you don't have the time to explain and describe all these things. It's been a real luxury of working in functional medicine. I remember my days in the last clinic I was at. I had 11 patients per half day. They all came because they were so excited that there was someone with an integrative, point of view to talk to. And 11 meant that I had 10 minutes per person, and 10 minutes means that as you enter the room, the only thought aloud in your brain is, how will I get out? So I was, increasingly aware of that. You can do some good that way. And obviously I'm not seeing the low income patients anymore. So that's sad. I'm glad I did the
Yeah.
20 years because it's important that they have healthcare as well. So anyway, I don't know if that's the reason why, or if it's just because people are more enamored or more technological things. There's also a way that you set into motion some healing mechanisms via paying money. Paying money for us is a statement, right? In this society is a statement that something is important to us and that we will give it our attention and our energy. But anyway, if people can get past that a little bit and try some of the no cost, low cost interventions, I think they'll be really excited.
Well, I think you bring up a really good point. When we're talking about, someone trying to heal from chronic illness, you talked about a couple of the things that you start with of blood sugar and nutrients and healing the gut. But you also suggested some of these other things that are important. One of those is being invested yourself. I think in the conventional model, we create a model of I am the doctor, I am the hierarchy, like you have come to me and I am above you, right? And when you come to me, I will heal you by giving you a medication or by doing a surgery. And it has its place. But for healing from chronic illness, it really does require a paradigm shift for the patient. The patient really needs to take on that ownership. And I tell my patients, I'm your teammate here. I'm not in charge. Like, I don't know what's right for your body. You know what's right for your body. I have a list of interventions, but I don't know exactly which one is going to be right for your body. Now, I have lots of experience that I can help guide you. So I'm not just saying I give you a list and you choose it, but it's really a big paradigm shift. And a big part of that can be in payment, recognizing that you have to be invested, financially, but also emotionally and physically into this healing journey. You can't show up and have someone heal you. And then I also think invested in learning. This is something I think a lot of people get already, but I think there are times when we're like, I don't want to learn that. I don't want to learn what I should eat. And if you really want to heal from chronic illness, I think you do have to be prepared to learn about your body. And I tell people it's almost a college degree. I mean, it's almost like you went and did this additional fellowship or this certification just to learn about your own body, because it is very involved, but it's worth it. But there are these other aspects to healing from chronic illness. Is there anything you want to say to add to that?
Yeah, and I think that the only reason that that's true is because we have a world that's set up against that.
Yes, exactly.
Right. And so if you walk into a store without any knowledge, you will not end up with the kind of food that will support your body's health.
Whereas before, the only things you could eat were what supported your
Whereas
health. So it
before,
was no
exactly,
problem.
you didn't have to go to school to learn how to eat because roots and shoots were the only
Yeah.
thing available. Yeah, and whatever animal somebody in your tribe could catch.
Yeah.
Absolutely. And same with exercise. Why do we need to understand how to do strength training and like the right way to do high intensity interval? Well, because otherwise we sit at a computer all day or in front of a little tiny screen and scrolling. And the same with strength with stress reduction. It's like, why? That same thing, like, because otherwise, in the past, I don't know, there was some kind of tribe, get together, and I don't know what it was, but we don't have that anymore. And why do I need to be so afraid of all the products in my house? Because there hasn't been enough, enough control around what's safe for humans. I came across something interesting recently because one of my recommendations is for air purifiers, and so I was writing an air purifier newsletter. I have a newsletter actually inspired from the book. It's called Simple Science. It's on Beehive, Beehive, Beehive. So I was writing my air purifier newsletter, and somebody said to me, "Why would I want to breathe artificial air?" And I was like, um, how? Which is artificial air? What is
Yeah.
artificial? Is that air that comes out of a purifier? And this person actually is an educated person. So it was like, look at the different ways of looking at things that we think are obvious. So yeah,
Yeah.
indeed, why would you want to be so careful, or why would you, what is over the top? And I think each person decides for themselves what's over the top. But the only reason that even comes up is because we don't live in our normal environment.
Yeah, it's such a good point, and it's annoying, frankly. It makes life kind of hard for all of us because there are so many evolutions of life with technological advances and in food and the way that food is manufactured and all of these things that are really working against us. And I think that we skate this very fine line in functional medicine of taking people and helping them to leave out the parts of our culture that are toxic, whether that's people or food or light or, whatever it is, like helping them leave that part behind and then keeping them here in the middle and not letting them go all the way to the other side where you're terrified to even go out in the day, or what are you going to buy, or what is this going to do to your body, or, we shouldn't do this. And there's lots of things that are kind of in the middle that are not great for us, but if we cut them out, then are they good for us? And then I think you have decisions that we're making based on society of like fluoride, for example, that, to take fluoride out of water, Utah just passed the law that fluoride will be removed from our water source, which has some really good sides about it. But there's also lots of people living in Utah who may benefit, from that, who aren't brushing their teeth
I
regularly.
know that's funny, right? Why is fluoride in there in the first place? Who is it benefiting, and what's a better way of those people being healthy? And are they going to do that? Are they going
Are
to
they
be
going to
rewarded?
do that?
Yeah.
Yeah. And I don't think there's any big answer there, but I guess I say that just to highlight there are some really complex and complicated issues. And we want to empower people to understand as much as they can. And at the same time, I've told my patients before, like, stop listening to podcasts, stop reading books, stop. Like, go get a hobby, go dancing, go hiking, like, go live your life. This should not take over our lives. How do you help people skate that line, especially when they're chronically ill? I think there has to be a graduation. I think you have to be a little more strict at first and then graduate. What has been your approach with helping patients kind of navigate that from needing to be quite strict when they're chronically ill, but then having it not become their identity, that they're so ill that they have to avoid all the things, right? Does that make sense?
So I think that, yeah, that's interesting, and I think that I'm just thinking this now, that I think over time this thing has been correcting itself. A lot of people come in to see me at first with that kind of attitude, like they really don't know, what they're
Everything is
allowed
so
to do or
scary.
able to do. Yeah,
Yeah.
and often or they're afraid that what I'll impose is going to be too restrictive,
Yeah.
and so often what I'll say is, look, let's see if you can try it my way. If you're willing to do that, try it my way, and we're going to do this for like 2 months or 3 months, or we pick a time. It's a fairly long time. I'm not saying two
Yeah.
weeks. I know functional medicine was like, eliminate the foods for 2 weeks. Yeah, 2 weeks, a little short. Try this for 3 months. I know it's a lot of supplements. I'm sorry. I know the foods are going to be complicated, and it means that you probably can't go out. Like, you have to bring your own food for 2 months, or I don't know, 3 months maybe. And then at the end of that, you'll have to make a list of the symptoms and which ones disappeared, which ones are better, how happy you are with the solution, and then you will decide out of those changes which ones are worth keeping and which ones you're going to give up. But see if you can give them up in a stair step kind of way, because if you get a symptom based on one of the, giving up one of the practices, then maybe you'll know, and also decide on a flare protocol. If your symptoms flare up, what do you think of the things that you did were the most impactful, using your intuition as well as using what you learned from reviewing labs and so on? What do you think was most impactful? Have them written down so that 3 years from now, if your GI issues come back or your joint pains come back, you have a flare protocol. So I think those are the two things. I think that people are not going to be able to keep all the balls in the air their entire rest of their lives. It could take up their life. I think this whole question of, you will live longer, but it will feel like you died or whatever.
Yeah.
I don't subscribe to that. No, usually it's a win-win. You give
Yeah.
up
Yeah.
something that it turns out wasn't that important, like
You
glue.
replace it with something else.
Yeah, and it's not like most of us could probably, like, there's one, I'm gluten free. Okay, croissants cannot be replicated with other flours. All right, fine. So a couple times a year, I'm not. It doesn't bring back my entire issues that I had, right? So in most cases, it's quite doable and doesn't. It's hard. It depends. I mean,
Yeah.
you probably have those. I have an older man who was with Parkinson's. His wife was trying so hard to minimize his symptoms, and glucose was one of the important things, and sugar and junk food in general. So they would go out to dinner with friends, and the friends would slip cookies into his pockets because they felt sorry for him because they knew she was keeping him away from desserts. It's like, ugh, she's
Who are you
working on
helping?
it. He
Yeah.
sort of accepted it. Like, really, do you need to undo it? But on the other hand, these are people who care about him. He doesn't want to cut them out of. I mean, one would not want for him to cut him out of his life. So
It's just complicated.
it's
Yeah.
you can't get it perfect.
Hey, it's Mallory. Can you do us a big favor? If you're loving the Uplift for Her podcast, we would be so grateful if you could leave us a rating or review on Apple Podcasts, Spotify, or wherever you listen. It only takes a second, but it helps us reach even more women who may need to hear our message. Click that 5-star button and let us know what you love about the podcast. Your support means the world to us. Now back to the show. One of the other questions that comes up along these lines is, I think one of the things that I hear from people is, I do a pretty good job. Like, how's your nutrition? I do a pretty good job. How's your movement? I do a pretty good job. Do you go to bed on time? I do a pretty good job, right? Talk to me about, with chronic illness, there are some people who we really have to do more than a pretty good job to get them healed. How do you help them address that and help them keep that in balance where they don't become obsessive about it, but also saying, like, this takes more than doing a pretty good job?
Yeah, I think that's complicated. I talked to someone recently. He had mild cognitive decline 6 or 7 years ago, and then this and that happened, and now it's not that mild anymore. And so, from what we know, there's no time to lose now, and he has to do all the things. And so, yeah, he walks, but he needs to do intense exercise. And yeah, he eats healthy, but he needs to go ketogenic, So everything he needs to really dial up. So, yeah, and the thing that the Bredesen protocol kind of shows is that it may take 6 months or up to a year and a half for people to start seeing improvements in their cognition. But if they get off the program, it could be 2 weeks before they start relapsing. Weeks,
Yeah.
which
Yeah.
is no way that's fair. If it took you 18
Yeah.
months to get better, why is it that it only takes you 2 weeks to get worse?
Yeah, I do think this is some of what makes it difficult for conventional medicine to accept some of this. I think conventional medicine doesn't like things that are hard for patients to accept. One of them was, I remember when there was some data that came out in the OB world about Tylenol during pregnancy, about maybe being linked to poor outcomes, and in the OB world, it was like, nope, we refuse to go there.
We
We're
need it.
not going there because we have to have Tylenol. And I think, like, I respect that, because I think in conventional medicine, we just want people to get better. I mean, really, I think conventional medicine can get a bad rap when we talk about functional medicine, but, like, truly, most doctors just want people to get better and feel better, and they just have the tools that they have. But I do think sometimes there's, like, the same thing with, like, PPIs, right? With proton pump inhibitors and omeprazole with gastroenterologists. A lot of gastroenterologists will be like, well, do you feel better on the omeprazole? Well, yeah. Okay, well, then stay on it forever. And you're like, what about those warnings that say it's going to decrease my nutrients and give me osteoporosis? Well, if you need it, you got to stay on it. And so I think that the conventional world sometimes doesn't like hard things. And I think we pride ourselves on saying, like, we're going to give you the answers, even if it's uncomfortable and even if it's hard. Conventional medicine does plenty of hard things. Like, they'll say, like, we're going to replace your joint. We're going to do a surgery to replace this joint, or we're going to put you through chemotherapy. Like, it's not that conventional medicine doesn't do hard things, but they do prescribed hard things. And I think a lot of what we do in functional medicine is relying on the person to make these lifestyle changes. And that's something that sometimes I miss, honestly, like being able to give a pill and being like, this is going to make you feel so much better. You don't have to change anything. Just take this pill and it will fix you. Like, I miss that sometimes when you're like, oh gosh.
I think that's why I like those party tricks, right?
I know,
I
right?
actually
Yeah.
have something for that heartburn, and it's not going
Yeah.
to be negative. I
Right.
actually
Right.
have something for the curcumin works for my joint pains. If I go hiking or whatever and I have an ache somewhere, First of all, it was kind of funny about podcasts. I was listening to Peter Attia the other day. Actually, he has a podcast on pain, which is really interesting.
Mm-hmm.
And at the beginning, I think I learned a lot from Peter Attia, but I love poking fun at him. So here goes. So he's talking at the beginning about how bros all like to say that they're really, they have a high tolerance for pain. So he's like, yeah, and I did some of those tests, and I really do. My wife too. We really have a very high tolerance for pain. And later on in the podcast, because they're like also 2-hour podcasts. So later on, he's like, yeah, I do take this when I have a muscle ache, and I do
Yeah.
take that, when I have a joint ache, and I do take that. And I'm like, Peter, I'm older than you are, and I don't.
Yeah.
I don't take anything or anything. Okay, so that hurts a little bit. Let's see what it does tomorrow,
Yeah.
or yeah, I guess when I went backpacking, I brought magnesium and curcuma veil, curcumin
Yeah.
along with me,
Yeah.
so like that's, I did not bring baclofen or some kind of
Yeah. Yeah.
medication or a non-steroidal or even Tylenol for that matter. We in fact were so old that we brought aspirin along just in case someone had chest pain on the trail. For the first
Thinking
time.
ahead.
Yeah. No, we're
Well,
like, wait, at 60, are you supposed to go up with a
yeah.
backpack up Yosemite?
Yeah. You are if you're living your best life.
It's a combination. We have more tools so we can fix some things that you would normally use medications for. And I think heartburn is an absolute excellent example of something we can erase just as quickly, but without the side effects. And also, then we're going to ask you to do the difficult thing that's going to get at the underlying cause, and that hopefully you will not need our little party trick either at some point.
Yeah,
And that's
exactly.
kind of that's where the hard and the easy come in. Or sometimes it is all hard. Like I had someone come in recently for rheumatoid arthritis, and we did everything. We did the nutrients, the glucose. The She wanted to avoid one pill, right? And I have to say, we didn't get it. We got some
Yeah.
of her pain, but we didn't get enough of her pain that she was able. Now she's going to get the meds after all. But at
Yeah.
the same time, she's healthier than she was. We know because we got at least one of her complaints, but not the other. And hopefully that'll protect her from that pill. And she also knows that she did, as much as she could have, and she didn't take the easy way out,
Yeah.
or she didn't. So I think that there's a benefit still
Yeah.
there.
Yeah. Functional medicine is definitely the long game. Yeah. And without fail, when you're treating things, they come in with a constellation of symptoms. And as you're doing these basic foundational things, without fail, someone says like, "Oh, do you know what? I had this symptom. I've ignored it for years, and that one went away." So
That one I
there
love.
are such great wins.
Or when they say, I forgot to tell you that I had this thing and it's
Yeah.
gone. And
Yeah.
it's kind of interesting because sometimes I joke that actually I don't really need to know what's wrong with you
Yeah.
because we
Yeah.
kind of do some similar things. But actually I do, because there's cautions to be had. And also because as doctors, having the training and experience that we have, sometimes we clue in on a symptom, right? Sometimes someone says something and you're like, yeah, I've listened to hundreds of people and this is a little bit out of the ordinary. Why
Yeah.
don't you go get something? And it turns
Yeah.
out to be correct.
Yeah, exactly. Well, will you go back to your book and tell us what are some of the pearls that we can get from your book? What are some of your favorite of the 60, I think, are they?
Yeah,
The
60.
60 different practices that can help. What are some of your don't miss practices that you share in there?
Yeah, so my favorite practice of all times is the fasting mimicking diet. There's no question. It's a 5-day vegan, low protein, very low calorie 5 days. And most people can do it. Some people do get dizzy, even dehydrated. So it's good to have someone to bounce ideas off of if when one tries it. But it is the far-ranging renewal diet. The sort of ancestral idea behind it is that, in fact, our ancestors probably were faced with periods of famine. Let's say a 5-day period where you really couldn't find very much food. You might chew on a few leaves and a couple of roots, but actually you don't have, the amount that, a person would need. And so that potentially the human body actually has almost like a program that starts running when you encounter one of these times, and that this program downsizes the body so that you can live on less temporarily, but downsizes it in an intelligent way. Let's get rid of the sick cells, the misbehaving cells, and so on. So we emerge from that 5-day period with better mitochondria, better set of gut bacteria, and so things that improve for anything to do with autoimmunity, glucose regulation, cholesterol, also gut health. And interestingly, fasting mimicking, which still involves somewhere between 700 1,000 calories depending on the day, is better than water fasting, which would involve 0 calories. And to understand that, you can go back again to ancestral, like, okay, so there's no food. Does that mean zero? You're drinking water all day? No, it means that you have a little this or that. You're chewing on some grass, you're eating something. I mean, a lot of things are edible out there, they're just not very nutritious.
And will you share, because there's good data for the fasting mimicking diet as
There's
well on
tremendous amounts
the
of data.
types of things that it helps. Tell us what it helps with.
Yeah, so specifically, they do 3 episodes, so monthly, 5 days, and then repeat a month later, and then repeat a month after that. So 3 times, 5 days each time, was shown to improve insulin resistance. So insulin resistance is the root cause of prediabetes and diabetes, and so that is improved by doing that. Why? Because it changes the communication between cells, the health of mitochondria. Yeah, it just does all those things. How does it do those things? Yeah, well, that is kind of interesting. I think this is what they're looking into. Um, Ulcerative colitis also had a big impact from a fasting mimicking diet. I think they're working on psoriasis right now because I know I observed it with my patients, and then I saw that there was a study. My patients who were coming in doing fasting mimicking, let's say for GI issues or for prediabetes issues, and they happen to have psoriasis, then they would say, oh, by the way, my psoriasis is much improved. And that wasn't even the goal. Like we were talking before, other things improve and you didn't even know what they were going to be.
You like it in general for autoimmunity too, right? Just autoimmunity
Yeah,
in
ulcerative
general?
colitis, right. And so initially they were saying that they thought that with autoimmunity, what was happening is that there were misbehaving immune cells that would get downregulated by the diet. Now they're talking more about maybe it's just that we've just altered gut bacteria. Gut bacteria are regulated by bile that comes out of the gallbladder. And if you're going to be eating a lot fewer calories, you're going to be eating a lot less fat because fat has so many calories. And so there isn't going to be as much bile. And so there isn't going to be the same kind of policing or regulation in. And so you're going to end up with different bacteria, and those turn out to be beneficial in some ways. Mm-hmm. That doesn't mean that you should continue that diet going forward. Of course, it's a very low calorie diet. Just because you can do it for 5 days doesn't mean that it's healthier to do it for 50 days. That's not, right. Yeah, you have to be smart about these things. And but this is my favorite intervention because I don't know of anything else that's so far reaching. People will say that their joints immediately feel better, that they're not as stiff in the morning, that some people feel clearer. And so it's really been amazing to watch people do that. And men especially will lose sometimes over 10 pounds in those 5 days. And you just have to scratch your head and like, well, I don't even know how this happened, but there's something that it and then liberates, for them. And I want to say one more thing. Women, perimenopausal, sometimes get this thing where they're gaining almost a pound a day. Do you have those patients?
Oh, yes. Oh,
and
yes.
They call in a panic. They're like, it's been 2 weeks. I've already got 10 extra pounds on me. Where is this going to go? You need to do something for me right now. The fasting mimicking diet will stop this cold, and then you'll be able to get a breath, try to figure out what's going on with the whole thing. And yeah, there's a kit that you can buy. Prolon is the name of the kit. The company is called L-Nutra, Nutra. And so on their website, you can buy kits and just do the diet yourself. And also they have educational materials and things. Yeah.
And you have a DIY. You sometimes help people do it on their own, I think, as outside of the kit.
There's programs online. Sometimes we joke, we call them fasting with food. Yeah. The company does not recommend them. I'm sure they have, whatever their reasons. Personally, I have an intolerance to rice, and these kits have rice powder to thicken the soups. And so I personally haven't been able to do a single kit ever because of the rice would give me joint pains, and I don't see why. So I've always done my own, and sometimes I really, 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 at the beginning, I used to spend hours trying to figure out the diet for the day. And now it's like, yeah, it has to be about 10% protein, about, 750 calories. That's not that hard to get to.
Yeah.
I know how to do it. Some,
Yeah.
nuts. Yeah.
Yeah.
Certain nuts
Well,
have more carbs, certain nuts have more fat. You can play with that depending on what it is that you're low on.
yeah. Well, thank you for sharing that. Is there anything else you hope people will get from your book, especially our audience is mostly women? Is there anything else you want to point out that your book covers or share with our listeners as regards to healing chronic illness, but also just all of the little hacks in your book?
Yeah. There's so many different ones that are related to mood, anxiety, and depression, which is something really common that we see. Also, heart rate variability. People talk a lot about that, but to get a little bit of a handle on that, or to have some tools to impact heart rate variability. So, heart rate variability is really your brain gathers information from your entire body and the environment and puts it together as like a little summary of it and sends it down to your heart. And this then determines the beat to beat variability. Are you going to beat like super rigid, or are you going to have a certain amount of give? And you do want a certain amount of give. You do want heart rate variability to be fairly high. And this turns out to be a predictor of severity of all illnesses, starting with mental health, but also autoimmune, cardiovascular. It's just a really strong, and it's a modifiable risk factor. And it's modifiable with things like breath work and tapping and some really free or inexpensive interventions. So that's another one I think that is good for people. Some of the journaling ones really I thought were incredibly powerful and also fascinating. You can impact your immune system by doing certain types of journaling. So I think those are really tools that people can learn fairly easily, and they're completely accessible and they're well researched. So for me, that's like the try.
Yeah. So wonderful. How do you hope people will use this book? Is it sort of a read it cover to cover and just kind of highlight what you want? Is it looking for help with a certain condition? I think it's a really good resource guide because you can just sort of flip through it. But how do you picture people utilizing the book?
Yeah, I think that it's interesting for people to read it cover to cover exactly and circle some things that they think might apply to them. And then, fortunately, there may be more to learn about some of the practices. So,
Yeah.
for example, I mean, I think fasting mimicking diet is an obvious one. Like, while you may that's one that everyone should try anyway. So you don't have to wait until you have a condition to do that one. And so then once you've tried it, then you know if it's for you, what you might be able to use it in the future if it turns out that your cholesterol goes up or your glucose goes up. But other ones, I was thinking to myself as I was writing it, like, you know what, I want this to come out right now. I'm not going to make it into a tome. There is a lot more to know about, doing this or that, but I don't, this is going to delay this book for decades. So you may have to get more information on how to do some of the practices, especially around exercise, strength training and all that. I guess so. That's another one where it's going to give you the health benefits, but probably everybody should be doing it. So yeah, I think each person would have, it's useful to read it and then think a little bit. Like if I wanted to apply this in my life, suppose this came around for me and I wanted to modify my symptoms, what would it take? And, if I think that I might need to use this, how would I find out more about it? Most things have a lot of information online, or you can reach out to some practitioners and see who has experience with them.
Well, I actually like that it's not exhaustive because I have some of those books and they sit closed unless you're looking for something specific because you don't read it cover to cover. And I think for people to kind of go through this book and highlight what stands out to them and then make their own list of like working towards, like eventually I want to incorporate these different practices into my daily or weekly routine. And this month I'm going to focus on this one. And next month I'm going to focus on this one. But making it so approachable and so usable, I think is really where the beauty in it lies, is that it's like I said, so many functional medicine books are so overwhelming because it's like, well, gosh, I have to revise everything. But this is like, just start adding good things in. Just start doing these good things and try it. See what you think. Come back to it if you like it. If you don't like it, move on to the next. So I'm so grateful that you spent your time and energy doing it, and sharing your wisdom. And I think you have so much experience. You've shared it in this book of like, these are the things that work, because you wouldn't have included them if they didn't work. And I think like I said, I've read so many of these books, and so often you hear the same thing over and over and over. And I think yours is different. I think it really breaks it down into, like I said, really doable, straightforward things. And people can utilize that as a list of, things to try and come back to it and try the next grouping of things and keep working towards it to feel better.
Well, thanks so much for all the kind words. It was fun to put together. It was fun to go back and look at, yes, but can I support this with any kind of articles? And then sometimes an article would lead to another, and you would discover something that you didn't know, you couldn't have imagined. Like, I've been working against, to try and reduce pesticides in the environment for so many years now. But there was literally a study showing that they were really following, and now I keep forgetting how the whole thing went, but they were really looking at sort of bats and deaths and that can be correlated to pesticides, but there was also a correlation to pregnancy outcomes. Wow. and I think it was premature births or small for gestational age babies. And so this is where you sort of stop and you're like, I was thinking that this could be the case, but I really actually didn't have the proof. And it's out there, and we don't know. Or the opposite, like, it's not as easy to find data that water purifiers are a big deal for health. There's some air purifiers really blew me away. Cognitive improvement, sleep improvement, of course, allergy improvement, blood pressure come down. It's like, air purifier. Okay. That's doable for a lot of people. Yeah. So anyway, it was really, really exciting. And I'm hoping it's going to be like that. Like, let's put these practices out front for people. Let's see how many people are actually start to use that as the basis. It's like, all right, I'm going to be at least this healthy, and then if I need help with whatever I'm still needing help with, then perhaps, that's more affordable, or it'll go faster or better. Or maybe even I won't need to reach out to a doctor. And the opposite, like if you've done all the functional medicine work, you should have a FLAIR protocol. You should have enough learning that you don't, we're not like a regular doctor that you need to go back to for a prescription every single time you have a UTI. Like, no, this is not this. This is like, here are your tools, here are your precautions, and here's a person you can call or email, and we'll support you in being as healthy as you know how to be or as you want to work out.
Yeah. Well, thank you so much for sharing all of this, Myrto. Would you tell people where they can buy your book, and also where they can work with you, and also where to sign up for your newsletter?
Sure. So my website is unconventionalmedicine.net, and it has a link to the newsletter Simple Science and also to the book, The Simple Science of Wellness. And the book is at Barnes & Noble. So it's the only place really where you can buy it at this time. The book is both an ebook and a print book, but I absolutely wanted to be a print book because I think that it's one of the ones that when people might want to write in.
Get their highlighter.
Highlight some things, yes.
Yeah, for sure. Well, thank you so much again for coming on. It's been such a good conversation, a delightful time to chat with you.
Thank you. I really loved it. And thanks for doing this.
Oh, for sure. Thank you so much for tuning in to today's episode. A huge thank you to our guest for sharing their insights and time with us. We are grateful for the incredible support from our sponsors and to all of you listening. We couldn't do this without you. If you enjoyed this episode, please consider subscribing on your favorite platform. You can find us on our website, upliftforher.com, YouTube, Apple Podcasts, Spotify, or wherever you love to listen. And if you found value here today, please share this episode with someone who would benefit from it. Leave us a comment or give us a review. It really helps us reach more listeners like you. Thank you for being part of our community. Stay tuned for our next episode. Lastly, this information is for educational purposes only and not intended to be medical advice.